Hello and welcome to the program. My name is Marie Yambo, and indeed this is Health and Lifestyle, where we talk all matters health. Our social media handles at Marie Yambo, at KBC Channel 1 on X and KBC Channel 1 on Facebook. Coming up in this program,
wanasema mtoto kama huyo hajaizaliwa kwa familia yetu, labda huyo sio mtoto wa hapa.
Birth defect, baby Joy's journey with cleft lip. Doctors on a mission to restore smiles. And on good practice, we look at some of the risk factors for cleft lip and some of the preventive measures that you can take. The birth of a child is supposed to be a happy moment for a mother. But for Raila Koth, that was not the case after she gave birth to baby Joy with a cleft lip, a condition that not only disfigures the face but can also cause difficulty in feeding. Raila shares her struggles of taking care of baby Joy and the stigma she faced. At the St. Francis Hospital in Kasarani, Nairobi County, Mama Joy prepares her daughter for surgery. Cleft lip is one of the most common congenital conditions affecting thousands of children each year.
Cleft lip and palate is a group of diseases that affects the mouth. It's a congenital disease. Congenital meaning that patients are born with the defect. It can either affect just the lip only or the palate, which is on the inside of the mouth, or what we call the roof of the mouth. So patients would tend to have a break in the continuity of the lip or the palate on the inside of the mouth. Because if you think of your mouth and your nose as two different floors, for example, in a house. So the mouth has a floor on top of, has a roof, all right? And then on top of that is your nose, okay? There are two different chambers normally. When a patient has a cleft palate, then there is a break in the roof of the mouth. So that's wet, so it's separated. So as opposed to the roof being like this, it is separated apart. So what that means is that you have a communication between the mouth and the nose. That is the cleft palate. And the cleft lip, like you said, is something that you can just look and see, that there's a break in the continuity of the lip.
For Raila Koth, the first few months of her daughter's life were filled with worry.
Wakati nilimzaa, tu immediately vile niliambiwa confirm the baby, nika realize kuna kitu imeniguara kwa kifua. Kuangalia nikaona ni gap, akona gap. Kusema ukweli nilistuka. Juu sijawahi ona kitu kama hiyo since nizaliwe. It is my first time. So pressure ilipanda. Ikabidi nipelekwe kwa consultation room, nikakonsultiwa, wakawa wanapima pressure, wananiconsult hivyo, then wakanipeleka kwa room ya wale wenye wako na shida kama hii. Nikaona they are worse than mine. So nili take courage from there, nikakubali the baby, nikaambiwa nijaribu kumnyonyesha, nikaona at least anashika matiti, anaweza vuta kidogo.
A cleft lip occurs when a baby's lip doesn't form properly during early pregnancy, leaving a gap that can affect feeding, speech, and appearance.
Kwa breathing ana shida, lakini wakati ananyonya, lazima avute, anaachilia kidogo apumue juu tit na hiyo nini na mdomo inafunika, yani inafunika mapua wakati namnyonyesha hiyo matiti. So lazima apumue kidogo, like namnyonyesha dakika 2 anapumua, dakika 2 anapumua, hivyo mpaka ashibe.
One of the first things that you tend to see in these kids is trouble breastfeeding. Okay, the kids are not able to latch onto the breast. So this would then end up presenting as things like malnutrition, because the kid is not able to get enough breast milk because they have problems latching onto the breast. The same with the palate. You can have now, when a child is feeding, you have food going in from the mouth all the way up to the nose, which can be very uncomfortable. It can lead to things like what we call upper respiratory tract infections, or like homa.
Lack of knowledge on what causes cleft lip makes such families a target for stigma and ridicule.
Vile nilizaa, Azini niliona kama ambaye nilianza kujiuliza swali mengi, kwa nini katikati ya watu wote mimi ndio nimezaa mtoto anakaa hivi? It is like kila mtu anataka kumuona, kila mtu anataka kujua hiyo shida imeletwa na nini, rejection iko, unaona, from the family. Wanasema mtoto kama huyo hajaizaliwa kwa familia yetu, labda huyo sio mtoto wa hapa. Umejua penye ulitoa hiyo mimba, unaona, kitu kama hiyo, ulitembea nje. Sasa unajua na mimi pia from the family sijaiona kitu kama hiyo. So lazima ikukwaze, unaona.
The cause of the condition can be both nutritional and genetical.
The disease is normally caused by, it can either be inherited or genetic. There's usually sometimes a genetic component to cleft lip and palate. Sometimes it can also be as a result of nutritional deficiencies in the mothers of these children, specifically related to folic acid. It's what we call a multifactorial cause, meaning that there are various things that in combination will cause a patient to have a cleft lip or cleft palate, or sometimes present with a combination of the two, a cleft lip and cleft palate.
Niliuliza swali mingi sana, alinielezea akaniambia hiyo shida number 1 inaweza kuwa imekosiwa na kama generation yenu ilikuwa na kitu kama hiyo. 2, akaniambia inaweza kuwa imekosiwa na ukikosa kumeza zile dawa za nini hizo za mimba hizo. Juu hiyo time ndio nini mtoto anaform.
Advances in modern medicine means this condition is treatable with surgery. The day of the surgery was nerve-wracking, but Ryle knew the baby was in good hands.
Kwanza wakati niliona hii tangazo kwa mtandao, nilisikia niko na raha, nilijaliwa na raha. Na nataka nishukuru Mungu kwa ajili ya hii organization. Manake leo hii naona kama ambaye leo naenda kuvuka ng'ambo ingine, unaona. Mtoto wangu hatawaichekelewa tena. Atakuwa kama watoto wengine, anaweza kula, at least hata makamasi ikitoka ipate way ya kwenda, unaona. Juu makamasi ilikuwa inatoka ikienda ndani.
Now, weeks after her surgery, Joy is thriving and her future is filled with endless possibilities. There are steps those planning to have children can take to prevent the possibility of a child being born with a cleft lip.
How to prevent this is to ensure that the mothers are well nourished, that they're getting balanced meals, that if they're able to, they're on all their nutritional supplements. And this is why we usually have very huge drives and a huge insistence on pregnant mothers always presenting to the clinics or the nearest hospitals so that they can begin their follow-up early for their prenatal clinics, so that the doctors and the healthcare workers are able to make sure that this mother is getting all the nourishment that they do require in order to carry a healthy pregnancy and birth a healthy child. So nutrition is one of the key things that come into play when we're talking about preventing cleft lip and cleft palate.
And for families facing similar challenges, Joy's journey offers a beacon of hope, a reminder that with the right care, every child can shine. What a happy ending for baby Joy and her family. Now, on Word on the Street, we wanted to know some of the myths and misconceptions that actually come up as a result of a baby being born with a cleft lip. Let's take a listen.
In late 90s and early millennium, in my rural home, we used to hear maybe the mother, it is a genetically instigated outcome. Maybe that lineage, they had that problem. So such myths used to come out. Also the behavior of the mother, especially during pregnancy, maybe smoking, drinking, using certain types of drugs. My grandmother used also to tell me, the grandmothers, the old grannies there, also used to say that habitual kind of factor can also spearhead the outcome of the unborn baby. I think surgery, such people, if they are from well-off families, plastic surgery is done. I've seen 2 cases here in Nairobi. I will not mention their names, but that can also aid in ensuring it is, but though it is expensive.
Cleft lip and palate. That is the crack between the roof of the knee. So I think kitambo, people used to think it's a curse, or the mother of the child had eaten something bad when she was pregnant, something like that.
Okay.
Yeah.
And how are these children treated in the community?
They were like abandoned, mistreated, and they were never taken to school because even eating habits zao zilikuwa ngumu. Hawakuwa wanaweza kula, so ungetaka hata kuachiwa mtoto kama huyo, hata kama wewe ni grandmother.
Yani ni kama kitu kama ya ukoo huko nyuma, maybe ilikuwa na shida kama hiyo. Inakuatana kulingana na kule kuzaliwa yako unakuanga naye. Kwa zamani walikuwa wanatengwa sana. Watu walikuwa wanafikiri mko na rogi, mmeroko huko nyuma, vitu kama hiyo. Sasa unakuwa unachukuliwa hiyo familia yako sio mzuri, iko na rogi.
Mara mingi katika community wanaamini ya kwamba mtoto akizaliwa na shida kama hiyo ni kama kuna laana ambayo inafuatana na yeye katika familia, katika hiyo kizazi yao. Ndio sababu mtoto ameweza kuzaliwa hivyo. Kuna madawa za kienyeji ambayo wanabelieve wanaweza tatua nayo, ama waweze kufanya kitu kama watoe sacrifice, ama ni traditional tu walikuwa wanaitibu hivyo.
Reconstructive surgery remains the only treatment for cleft lip and palate. Dr. Alex Gonga, a plastic surgeon, was among a team of doctors who conducted reconstructive surgery on 68 patients during a medical camp. Dr. Gonga, thank you once again for giving us the time to talk to you. So we've already learned that cleft lip palate can be as a result of nutritional deficiencies, or it could also be genetic. But could cleft lip palate also be an indication of other health conditions, underlying health conditions?
So sometimes indeed it can come with other associated malformations and syndromic cases, or it can just be an isolated case, cleft lip, or an isolated cleft palate, or a combination of that. And like what we've said, there could be predisposing factors, but sometimes when you really dig back into the pregnancy and all the other issues, most times you can't find something to blame. The good thing and the good news that we always tell patients affected, families affected, is these can be corrected, and we are here partnering and assisting offer that repair, reconstruction of that defect. I think that's the most important thing that I like to present to affected families, affected communities.
Could you describe to us some of the severity? Yeah. Could you explain to us the severity of cleft lip and palate conditions? Because there could be those which are minor, but then we could have those which are really, really major.
True. It's a wide spectrum of defects, like what you've seen. It can come with just a small nick on the lip until where the whole lip is actually open. The same on the palate, can be just something minor or something quite extensive. In all that whole spectrum, we offer appropriate repair, reconstructive techniques that will help correct the defect. I think that's the most important thing. No matter how severe it is, there is some assistance that can be offered to correct that deformity. So for any affected mother, affected society, family, channel them to us so that they are offered for free. That's the good thing. Because of the collaboration from Smile Train, Kiss Plus and UN, these things can actually be assisted and offered for free. Thank you.
Surgery seems to be, can I say, the only way to correct, cleft lip and palate conditions. Maybe you could talk to us about, this camp that has been going on and some of the conditions that you've been able to come across?
So it's a camp that started on Sunday, running all the way to today, in which we offer comprehensive cleft care to patients that are born with a cleft lip and cleft palate. As you know, this is a very common challenge in our society. Children are born with a cleft lip, cleft palate, and most times they're coming from very underprivileged societies, and they don't know how to be assisted, or they are financially not able to reach out to this service. So we are offering, in partnership with the University of Nairobi, Kenya Society of Plastic and Reconstructive Surgeons, supported by Smile Train, to offer free comprehensive cleft lip and cleft palate care. Yeah.
So apart from surgery, so when a child has been operated on and their lips have been fixed, the palate has been fixed, are there any other, therapies? For instance, cleft lip and palate also causes, speech impairment, if I may call it. So are there other follow-up, therapies that come after the surgery?
Indeed. Like what I highlighted is comprehensive care, which involves multiple disciplines. As we are looking at the surgical interventions, the care that these children need include nutritional support, because they have feeding issues, for which we involve nutritionists to support them before theatre and even after theatre. Some might have speech issues, for which our speech therapists are roped in to assist with that speech aspect. As the surgical team will be there to offer the safe reconstruction of that defect. So it's multidisciplinary, multiple departments are involved depending with the defect that the child presents with. That will mean how many more departments are involved or are required to assist the child.
Are there cases where a child may need more than just one surgery to correct a cleft lip and palate?
So okay, I'll just give an example of the simplest case in which someone presents with a cleft lip and a cleft palate. At an appropriate age and at an appropriate weight for that age, we usually start by operating the lip, close it, okay? And then later on, when they are above 9 months or so, and they've been optimized weight and nutritionally, etc., you then repair the palate, okay? In a few cases, in case there are complications or they are not happy with the scar, revision surgeries can be offered. Some will need correction of their teeth, etc., because of the defects that will be there. Appropriate orthodontic services can also be offered later on. The good thing, it's a journey that we start with the mother of the child, of the patient that's affected, and we offer assistance until they've gained the most of the deficit function that they have. Like what you've noticed, the correction is surgical, which is why actually you are here in theatre. There are various techniques that we employ to repair a lip, to repair a palate. I might not go into those technical details, and the most important thing is it can be corrected as long as they come to qualified, board certified team members like us. They will be presented and offered safe surgery to correct that deformity. Yeah.
So we talked about the support for the family, yeah? So cleft lip palate causes a lot of emotional issues. Maybe not for the child who's unaware of what is happening when they're born, but for the family. What kind of psychological and emotional support do these families need?
That's true. So for a child that's just been born with a cleft lip, we offer nutritional support, psychological support. The cleft lip, we typically repair it when the child is around 10, 12 weeks, 3 months of age. By then, we expect the child to be approximately 5.5 kilos, which is an appropriate weight for that age. They are not malnourished. In case they get to that age and they are still malnourished, it's not safe to offer. You still support them until they've gained appropriate weight for their age. Then the palate, we typically repair it at least 9 months to 1 year of age. Similarly, we'll emphasize on weight and other physiological parameters which should be well optimized before you offer surgery so that the whole reconstruction is safe. It's really something very traumatizing to any family to give birth to any deformity. More so something that's very expressive on the face, on the lip. So it brings a lot of trauma, a lot of tension to couples. The hope that we give to them, the good news that we give to them is it's something that can be corrected. Come with us through this journey to help the child bring them back that smile again. Thank you for sharing what we are doing and putting it out to all the community out there so that they actually know and realize that indeed we can offer service to these affected children. Thank you once again.
Indeed, thank you to the doctors who not only restored smiles for these babies, but also the emotional well-being of their families. Now let's take a look at good practice today, where we focus on some of the risk factors in as far as cleft lip and palate is concerned. Several factors may increase the likelihood of a baby developing a cleft lip and cleft palate, including parents with a family history of cleft lip or cleft palate face a higher risk of having a baby with a cleft lip. Cleft lip and cleft palate may be more likely to occur in pregnant women who smoke cigarettes, drink alcohol, or take certain medications. There is some evidence that women diagnosed with diabetes before pregnancy may have an increased risk of having a baby with a cleft lip or with or without a cleft palate. There is some evidence that babies born to obese women may have increased risk of cleft lip and palate. It may not be possible to prevent it, but there are steps that can be taken to cut the risks by ensuring adolescent girls and mothers have a healthy diet, ensuring an adequate dietary intake of vitamins and minerals, particularly folic acid in adolescent girls and mothers, ensuring mothers avoid harmful substances, particularly alcohol and tobacco. We've come to the end of the program. Thank you so much, as always, for making the time for us. And of course, on behalf of everyone who made this program possible, Mama Joy for the courage to share her story and the journey of baby Joy with cleft lip, and of course the team of doctors who are doing a good job in the community. And as always, if you've missed any part of this program, you can always watch it on our YouTube channel, and we'd also like to hear from you on our social media handles at Mariambo, at KBC Channel 1 on X, and KBC Channel 1 TV on Facebook. My name is Mariambo, and see you next time.